Dear Honourable Minister Hajdu, my name is Natasha. I am a registered nurse and the Clinical Intake Director at TheraPsil. I feel deep gratitude to live in Canada and to have a Minister of Health that understands Canadians should have a right to utilize psilocybin-containing mushrooms in search of emotional healing when all other treatments have failed them. Thank you from the bottom of my heart for granting 28 Section 56 exemptions for the patients that TheraPsil has advocated for so far. I'd like to remind you that you really are changing the lives of so many people. I am blessed to be directly connected with the patients you have provided exemptions for on a regular basis. I hear their stories, their pain, and their struggle. But I also hear of the newfound hope and healing they are finding within this structured and safe psilocybin psychotherapy framework. The approval of these Section 56 exemptions is not only improving the lives of these 28 patients. There is a domino effect of light that reflects from all the lives intertwined with each one of these patients. Humanity as a whole is much more interconnected than we normally tend to comprehend. I believe this movement towards emotional healing for these 28 patients, in turn, spreads waves of light and healing to so many others that they're interconnected with. Thank you, Patty, for allowing this healing to occur. But it is devastating that it is a normal part of my reality that some individuals I connect with die before we are able to get them legal access to this treatment. Along with the 28 Canadians you have granted exemptions for so far, 7 more are currently waiting for a response to their request for legal access, one of which has been waiting over 90 days and another over 70. These individuals awaiting a response are facing a reality that their lives may be cut short due to illness. Their life is in limbo. Daily, they cope with extreme stresses of waiting for test results, physical challenges, medical procedures, managing medications, and planning for what might happen when they're no longer around or they have a disease reoccurrence, as well as all the compounding emotional distress that comes from this reality. And on top of all that vulnerability and all that stress, these patients are now left hanging in another limbo. They're spending months not knowing if they will receive legal permission to utilize psilocybin to treat their distress. I have witnessed the increase in anxiety and distress that this is inducing. I've reached out to many of these patients to counsel them through this uncertainty. And on top of those 7 patients currently awaiting response, I am working directly with a list of additional Canadians in need who are hopeful to soon submit an application and gain access to legal treatment their fellow Canadians have received. Part of my role at TheraPsil is to ensure each patient we advocate for is connected with qualified and trained health practitioners who can provide safe treatment. But there is a limited pool of these practitioners to refer to. As you know, TheraPsil is in a unique position in which we now have high-quality psilocybin training for health practitioners available. And in order for practitioners to complete this curriculum and then be available for me to connect these patients to, they must complete an experiential training. This is not just to understand the experience themselves, but also a safe container to practice their skills with a supervisor present. I myself am currently in the first legal psilocybin-assisted therapy training cohort in Canada. And I am thankful for you for granting me my own Section 56 exemption for psilocybin use for training. But my colleagues, who I am relying on to finish their training, in order to support the many current and future patients, they also need to complete the experiential portion of this training as well. Please grant them the same rights you granted me, to have legal permission to possess and consume psilocybin for their learning. Health Minister, again, thank you so much for your compassion, but please continue to grant Canadians in medical need their Section 56 exemptions, and please grant my colleagues their Section 56 exemptions for training as you granted mine. Thank you for your time.